All right, before we actually start getting into the steps of collecting blood, I want to talk about assembling your needle here. Now, this is important because I want you to understand that there's for me, a right way and a wrong way to assemble a needle safely. Now, most people like to assemble a needle their own way, and I've seen many people, including my students, stick themselves because they had assembled the needle the wrong way. Now, I'm going to talk about this in a minute because I want to make something clear. When I go into a patient's room and after I do the patient ID and I make sure that the patient is who he is, and if you go back to my lecture videos, I talk about the steps, the 3 P's of asking a patient, which is important. So if you're not familiar with that, please go back and watch that. I like to assess the arm, both arms. I like to tie the tourniquet on with my gloves, like you saw earlier, and then I like to palpate and look for a vein on either arm. And once I find a vein that I'm comfortable with, then I release my tourniquet and I proceed to get my equipment and assemble, letting the arm rest. But I do like to assess both arms and even the back of the hands in case I can't find a vein on the arm, specifically in the antecubital fossa area. I look for the median cubital, I look for the cephalic on the outer part, and of course the basilic on the inner part of the arm. Basilic is always last. I'd rather do the back of the hand, and I explain that in my other videos on the order of veins. So again, I always assess both arms, including the back of the hands, to feel comfortable, and then as the patient is resting on the site that I'm going to be drawing on, I get my needle and my equipment, which I'll show you in a next video. Now, this is important because the green side is the part where the needle is. Now, every needle has the gauge, and it tells you on there, if you're not sure, it'll tell you on the sticker here if it's a 21 gauge or a 22 gauge straight needle. Typically, you're going to find only 21 and 22s in labs and hospitals, but the most preferred and the preferred needle to use on any venipuncture is a 21 gauge needle. So if you see that on an exam, the most preferred needle, it's 21 gauge always. This plastic part here covers the rubber sleeve, which I'm going to show you, that actually covers another needle. And you got to be very careful because you can't stick yourself with this needle. What I'd like to do is grab my 2 fingers and my finger and my thumb right on this pink plastic sheet here, which is a protective sheet. Grab it right there at that midpoint to my finger and my thumb. Hold it, twist the white off just like this, pull it away. I don't like to do this because I've seen people come back and stick themselves. I like to twist and pull away. Now again, there is a needle in here. If I pull back on this rubber sleeve, which do not do or recommend this, but I'm going to show you, there is a needle in there that collects the blood into the tube, and this rubber protective sheet covers the needle and also helps prevent carryovers into the other tube. So again, protective sheet, this protects the needle and also prevents carryovers. I take my plastic hub, my vacutainer holder, and I bring them together. I don't like to do this, and I'm going to show you because again, you can stick yourself like this. I bring them together carefully and I attach the hub on there, make it nice secure, hold up. I bring the plastic sheet down. I make sure that this is still secure, and now my needle is ready to go. Let's talk about palpating the site, vein locating. Let's talk about getting the site ready. Of course, we're talking about anchoring the vein. We just talked about assembling the needle, the order of draw, the tubes, and of course, let's get into the whole process of how we do this. Now, a couple things you understand. There is always a right and wrong way to draw blood, specifically the order of draw, the order of veins. There is a CLSI standard, that's the Clinical Laboratory Standard Institute. If you're not familiar with that, you need to go back and watch some of my videos on the agencies and different procedures that they recommend. Now, we already talked about the tourniquet. Now, what I like to do again when I assemble my needle is exactly how I showed you. So, what we got to talk about now is locating our veins. So, once I've gone and I've ID'd the patient, and I told you before, I tie the tourniquet, I want to locate a vein and make sure which one is the best vein possible. Then, of course, I want to make sure that the patient is comfortable. I'm not rolling my tourniquet here, and I've got good veins. I want to take my finger here. Now, this might be a challenge with the gloves, but you have to learn to feel a vein with your gloves on. I don't like palpating an arm without gloves because, again, I don't know if the patient has anything on the skin. I don't want to, catch anything or transmit anything to myself without the gloves. So you're going to have to learn to master this. Now, I like to palpate. What I like to do is I like to push down with my index finger here. Some people like to use the middle finger, which is fine. I don't use the thumb. The thumb, because of the artery, the radial artery, you can get a pulse on your thumb if you're doing this, and you might think you're hitting the brachial artery when you're not. So I want to make sure that I don't use a thumb. My index finger or middle finger is fine, but here I like to palpate, push around, push down, feel for sponginess. I want to feel the depth of the vein. I want to feel the width of the vein to see how wide it is, if it's good for my needle, 21 gauge. I want to feel how deep it is, because again, we have to look at 15 to 30 degrees only. We can't go anything above 30 degrees. So it's typically up to 30 degrees, or I like to say 15 to 30. So I like to palpate, feel for my vein, different directions, where the vein is going, how deep it is. And once I locate a vein, that's when I will get my equipment ready. So I found a vein I'm good for, whether it's the median cubital, which is dead center. And again, look at my order of vein videos. The cephalic, that could run median cephalic, or if cephalic runs straight, or it could be median cephalic. Or of course the basilic. The basilic can be median basilic, or it can be basilic running straight down. This one I do want to avoid at all costs because the brachial artery, and again, my order of vein video does explain this in detail. So I find my vein, either median cubital or median cephalic, then I'm ready to go. I release my tourniquet, pulling towards myself, and then I go into assembling my equipment like I just showed you. So I take my needle, 21 gauge, pull it here, attach my needle, bring this down, make sure it's secure, and I place it down. Now you're going to notice that all my equipment is on my right side because I'm right-handed. If I'm left-handed, I want all my equipment over on my left side. The reason being is I don't want to be drawing with my right hand and have to, or if I'm left-handed or right-handed, depending, I don't want to be drawing here and having to reach over. So if I'm left-handed, then here I can take my equipment. So in this case, I'm right-handed. I bring my stuff over here, just like this. And now I'm ready to go. Now this is, of course, so that when I'm in, I can easily get my equipment. I don't have to reach over. So again, depending on which side, if you're right-handed or left-handed, you want to make sure your equipment is on the side that you're going to be reaching for to grabbing your tubes, not on the side that you have the needle. I don't want to be reaching over because that can cause the needle to move and discomfort for the patient. Okay, so everything here is ready to go. Now let's talk about the alcohol, palpating the site. So here we go. I'm going to leave this on just so you can see the whole steps. Of course, it's going to be longer than 1 minute, but I'm basically going to be showing you so that when we do it, you'll see it will not go over 1 minute. So again, I've located my vein 3 to 4 inches above the site, located my vein. I'm going to tear open my alcohol. Now, some people like to take this and just start doing this. And all you're doing is just circling over the site. That's not cleaning the site. All you're doing is taking whatever is on the arm and on the alcohol pad collected and just going in a circle and just distributing whatever's on here. That's not cleaning the site. What CLSI standard is that you fold your alcohol pad, usually in quarters, start from the center of where you're going to draw from. Let's say I'm going to just say the median cubital is right here. I'm going to start from here and work my way out in symmetric circles, working outward just like this. So now I have not rubbed the site over. I've worked my way center out, and then I'm good and I let it dry. Now, some textbooks will tell you do not blow, which you don't. You never blow on the site because some alcohol pads are wetter than others. Some textbooks will say don't even wave your hand. I don't mind this. This is not going to stir up air current. If I'm breathing and talking, that can stir up air current. If you're blowing and you're bringing your mouth to the site and putting whatever's in your mouth on the patient. Now, again, you cannot touch the site. You cannot repalpate. Once you alcohol the site, it's off limits, so you better know where you're going. This is where your skills kick in, and as many times as you do a blood draw, that's going to tell you where it's at. You should automatically be focused on where this is. And I'll show you another technique afterward about marking the site with your cap here before you alcohol. Now, once you're ready to uncap the needle, and you're ready to go here, your 2 fingers and a thumb, basically you're going to turn your hand face down, palms down as usually I like to say, and I like to grip the cap of the needle, and I like to pull away. Try not to twist and pull, because if you twist and pull, you could actually take the needle and unscrew it. So palms down, grab the pink protective sheet, and pull away. This is the best way to retract without doing this. Do not pull away this way, and do not pull it towards you. Simply aside and away. So let me show you one more time here. Use the scoop method. Right here, 2 fingers and a thumb, palms down, grip the cap, pull away, set it down, and now you're ready to go and you're ready to draw. This is very important here, because if you look at my needle, the bevel, which is the shaved part of the needle, must be always facing up, and that way the lumen in the needle is facing up. If it's not, if the needle is sideways or upside down, I won't get blood half the time. The needle or the bevel can be against the vein of the wall, blocking the lumen. I could be upside down, again, blocking the lumen. I could be halfway in. I've got to know that the bevel is always up. I always hold this 2 fingers and a thumb. Everybody holds it differently. For me, the most comfortable way is 2 fingers and a thumb. I'm leaving enough room here in the back for my tubes so I can get my tubes in and out, which I'll show you, so they're free to use the little phalange grip here to push in. So I like to use, of course, 2 fingers and a thumb, leaving enough room here, and I feel more comfortable so that when I'm ready to go in, I have a perfect set spot for my fingers. Some people hold it differently. Some people hold it like this. It's a little harder for me to get tubes in here, depending on your preference, but I prefer 2 fingers and a thumb closer to the front of the vacuum holder. And once I'm ready, I'm going to anchor the site or retract the skin. I don't want to retract up here close to the site where my needle and my hub have to go over my thumb. That will increase my angle of insertion, and that can also cause me to miss the vein or go too deep, and can cause harm to the patient as well. I want to retract towards the forearm or below towards the wrist, pull back so I have enough free area right here to go ahead and draw with no problems. So again, do not retract up here where my thumb is. If I'm doing this, then I'm too close. Retract below so I have a good angle, 15 to 30 degrees. And once I go in, I'm looking for the bevel to go in, which is right here. Now, typically this part should be lined up with the bevel, so you know it's up. So if the pink's up, the bevel's up. Retract, make sure the bevel goes all the way in, and then hold. Now, once I do this, I'm going to get my tubes. Now, if you look at the order of draw, of course, you can go light blue, red, of course, SST, green, and lavender. Standard order of draw. I'll show you where the red top can precede the blue on a butterfly draw to get the air out of the tube on another video. But again, I take my light blue, I put it in, label up. And if you see, my 2 fingers are resting. Let me explain this real quick. My 2 fingers are resting on the arm. It's not floating like this where my needle is moving. If the patient moves, it can mess up my needle. Once I go in, 2 fingers and a thumb, retract, push in, my 2 fingers rest on the forearm. I should have some pressure, not too much pressure, but enough where my arm will move with the patient. If he moves, my hand moves, and it doesn't just cause this type of effect. Okay, so again, retract, bevel up, go in, hold, light blue tube, label is up. The label is down so I can see blood flow. If the label is facing up, it's harder for me to see if there's any blood, because sometimes the blood will start to creep in and it's not flowing in good, not flowing in enough, or the strength of the vacuum is not pulling it enough, because maybe I'm not in the vein far enough. So basically I'm looking for, and I can't see if the label's up, so I turn it. And so when I push in with my 2 fingers and my thumb behind the tube, 2 fingers on these little phalange grips, push in, and I should get blood flow. I can see it squirting in. If it's not, then the only thing I need to do, the only adjustment I can make to this needle, which is again on my other videos, is either going a little bit deeper, or if I think I went too far, pulling a little bit back. I cannot, and this is against CLSI standards and against patient care, and this can cause damage, is redirect my needle. I can't fish, what they call fishing. Fishing can cause damage to the inside of the arm. That needle is like a miniature scalpel. As I'm moving it, it can cut the tissue, it can lacerate the vein. I could even hit an artery and lacerate an artery if I'm not careful. You should never fish in a patient's arm. I could only go a little deeper or pull back. If I get no blood flow on either pushing or pulling back or even retracting a little bit to help stabilize the vein, then I've missed the vein altogether and I need to start over. Once I get blood flow, then what I do is I'm going to remove my tube and get another tube. Again, no fishing. These phalanges is going to help you take the tube out. I don't want you, two things. I don't want you to put the tube in by pushing it in, because that can push the needle in the arm. Don't push it in, and don't pull it out. Once the tube is in, what I'm going to do is take my index finger here, rest it on the inside right here of the phalange. My middle and my thumb is going to grip the tube. I'm going to twist and push away with my finger to release the tube. Invert the tube at least 3 to 5 times, set it down, grab your next tube, slide it in, label down, 2 fingers and a thumb on the phalange here, pop it, let the blood flow. My index finger rests right here, middle and thumb twist and push away once it's full and it's stopped, and this will help release it. Invert, bring it down. SST tube next, then my green and lavender. So again, label down, pop, let it flow, index finger right here, middle and thumb grip the tube, twist and push away, invert, set down. Once I'm done filling up all my tubes, and I'm not the 1 minute mark, then I'm going to release my tourniquet. Now some people like to release it while they're doing a blood draw. So if my last tube is my lavender, and I'm doing this and it's getting blood flow, some people like to release the tube prematurely while it's filling up. The problem I have with that is that if this tourniquet is helping venous restriction and it's helping me get blood in, the minute I release that tourniquet, I could cause the blood flow to stop. It is a possibility. If you're in the vein well and it's getting good blood flow, it might not happen. But if I'm in and this is actually doing its job and it's actually helping, squeeze the vein a little bit to help restriction to push the tube with the vacuum in it and getting the blood in, me releasing it before it fills up could cause the blood to stop. And then I have to restick the patient, which I never want to do. So what I want to do is first pull my tube out, invert, put it down, release my tourniquet the way I showed you, pull towards you, and then get my 2x2 gauze right here. What I like to do, I never like to put my 2x2 over the needle, okay? I keep it on the side. The reason being is, again, safety. If I put my hand over the needle and just place it here, when I come out, if the patient should jerk or I get bumped, where is the needle? It's lined up right here in front of my hand and finger. And if this needle can go right through the gauze and stick me with a contaminated needle with blood on it. So I don't want to do that. So once I'm in, do not bring your hand over. It is dangerous. I've seen people get stuck that way. I come on the side right here next to the arm. I bring my needle out, and as I move away, I cover and place my 2 fingers over the site, immediately capping my needle. Once I cap it, then I dispose of my needle, and I keep pressure here, or I have the patient put pressure over here. Now, if you look at my post-care instructions video, where I talk about what I do next, you should have watched that video on post-care instruction. I leave pressure on here with the patient either putting his own thumb, gripping it right on his arm, or he can put his own 2 fingers on there. I come back 3 to 5 minutes, checking, making sure it stopped bleeding. If it isn't stopped bleeding, if it's still bleeding, I go 3 to 5 minutes. If you watch my 3 Ps, you'll know why they could still be bleeding. So once I check 3 to 5 minutes, it's good, no blood flow, it's not bleeding, plus over, I use gauze. I do not use tape, and I do not use band-aids. Again, CLSI does not recommend tape or band-aids anymore, because tape and band-aids can rip the skin and cause skin irritation and again, discomfort for the patient. We use Coban, self-adhesive Coban. I wrap the arm in Coban, not tape and not Band-Aids. That prevents any irritation or tears on people who have sensitive skin. The Coban is self-adhesive, it wraps around. I keep it on there. I let the patient know to not lift anything heavy for at least an hour. I tell them to keep the bandage on for at least 15 minutes. Again, this is post-care instructions. And I tell them that if you lift anything heavy within the hour, you can cause a bruising, because again, the weight on the arm that they've just punctured can cause bleeding on the inside with like pressure. So I tell them no lifting for 1 hour. Keep the bandage on for at least 15 minutes. All right. And of course, I assess the patient to make sure that they're either able to get up and walk, and they're fine. Remember that.